Thank you, Madam Speaker. My question's to the Premier. Premier, can you explain to Tasmanians who've sacrificed so much since this pandemic hit, what is the difference between an essential worker, an essential traveller, and someone who's subject to 2 weeks mandatory quarantine? Before you say this is a matter for the State Controller, will you accept this is a matter of government COVID-19 policy and explain how people wanting to come to Tasmania to attend a family funeral can have their applications rejected, but in an age of video connectivity and electronic signatures, a hospitality industry executive can get a quarantine exemption to attend the Crown Plaza launch? This after your party's backer at the last election, the Tasmanian Hospitality Association's Steve Old, asked your government for help to secure the exemption.
Thank you. The Honourable the Premier.
I thank Ms O'Connor, the Leader of the Greens, for that question and her interest in this particular matter. There have been some difficult decisions that have been made. I understand that. I understand it more than anyone. I've picked up the phone and I've spoken to people when they've asked for exemptions for children to come back for a funeral. In fact, some of the hardest calls that I made were in fact back in March when we put the first border controls in. And obviously there were funerals planned for that coming week, and there were some very difficult discussions and conversations that had to be had with people. I recall one with a parent in terms of wanting a child to come back so that they could bury one of their other children. As I explained to that parent, the rules that we've put in place have been put in place based on public health advice to protect people. There was evidence in New South Wales, I think, shortly before we put our border controls in terms of transmission that occurred, one at a wedding and I think another one at a funeral. Unfortunately, these settings are conducive to the spread of the disease.
Unlike a Crown Plaza launch?
These settings are conducive to the spread of the disease. In terms of the exemptions that are provided, as I've said, I'll be saying more about them later today in the ministerial statement and in terms of our broader plan going forward. But the people that we have tasked with doing this job are doing their very best to get the balance right. On one hand, Madam Speaker, they need to balance up the continuity of what has been a very fragile economic situation, and they make decisions that they feel, based on advice and based on information provided by employers, is going to stand our economy and the jobs of Tasmanians in a good place.
Yeah, I think you should go to the question.
This is a very difficult issue, Madam Speaker, for the people that are making those decisions, because on one hand, anybody can argue that a compassionate exemption for certain circumstances is much more worthy than keeping Tasmanians in work. That's an easy argument to make. But unfortunately, unfortunately, Madam Speaker, these decisions have to be made, and I know that the people that make them wrestle with them. The one thing that I do want to make absolutely clear here is that there is a process that is undertaken. Biosecurity Tasmania in the first instance receives applications. They then assess them. It then goes to the State Control Centre.
This one was turned around in less than 48 hours.
There is a further assessment. There is a further assessment that is undertaken, and then a final decision is made by the State Controller at arm's length from the government. The rules underpinning these exemptions are put in place by public health. The rules underpinning these exemptions are put in place by public health. And
Dr. Woodruff.
whilst it is difficult, and I know that it can be an easy political point but we are the point that I want to.
You need to explain the difference.
Ms O'Connor, through the chair, please.
I think you might be wanting to make a political point. Forgive me.
You let an executive in for a Crown Plaza.
Forgive me.
Ms O'Connor, you've made that point.
Forgive me, I think you're continuing to make that political point.
Well, it's actually
We are
a
in
really
the midst of
important
the
point.
midst of a pandemic, and there are people that are tasked at arm's length under the State Emergency Act, under the Public Health Act, with ensuring that they protect Tasmanians. And in the main, they've got those decisions right.
You think they got this one
In the
right?
main, they've got those decisions right. And I'm not going to second guess those decisions because they are based on the advice that's provided to them at that particular point in time in terms of the tasks that are being required to be done. And I have confidence in the people that are making those decisions, and I will continue to have confidence in them. Now, again, it's easy to make the political point.
I'm not trying
But
to do
we
that.
are in the midst.
Genuinely not.
We are in the midst of a pandemic, and I would again
Exactly
make.
why
I
we
would
asked
again,
the question.
And I would make this point. We're not Victoria. You know, we are not New South Wales. We're not Queensland or South Australia or New Zealand. We are Tasmania, and at the moment we're in a pretty good place.
Well, say no to people
We
who
are
want
in
to
a
attend
pretty good
funerals, but
place.
yes to executives
We are in a pretty good
who are
place.
connected to the THO.
Ms
We are in a
O'Connor.
pretty good place, Madam Speaker, and we will continue to act on the advice that's provided to us by the experts, and they will continue to act as they do under the Acts of Parliament that guide their actions to deliver the best outcomes that we can for Tasmanians.